Recognize Mrs. Fischbach.
Thank you, Mr. Chair. And I, like Mr. Smith, I serve a very rural area. Dr. Basel, thank you so much for being here today and for your work with Avera Health, which serves so many of my constituents across the 7th District. And if you're not familiar with it, I am the western half of Minnesota. So I border Canada, North Dakota, South Dakota, so there are a lot of Avera facilities in my district. And I appreciate that Mr. Smith from Missouri, had brought up some of the rural issues, the rural patients, and some of the other folks have too. But given your unique perspective overseeing the regional Medicare Advantage plan and the clinical operations across the 38 rural hospitals, I'm wondering on how prior authorization policies specifically affect rural areas, the rural discharge planning. And I mean, we've seen data showing that MA enrollees face longer hospital stays, and I think you mentioned maybe some of that during some of your testimony due to delays and to improve the post-acute care. Can you speak to some of these, how these delays affect patient flow and hospital capacity in your rural facilities in particular?
Yeah, so the main issue here is going to be prior authorization delays for skilled nursing care. A lot of our rural areas, we actually utilize skilled nursing care a little bit higher. When you live 45 miles away from the nearest hospital, you're more likely to send somebody to a skilled facility than you are if you live 2 miles away from the hospital. And so those delays in getting people out of the hospital and into that convalescent mode, it affects direct patient care. The hospital is no place to rest. It's no place to regain your strength. And so getting them to that next level of care is important. So that's one piece of that directly affects the patient. The other care is it clogs up the hospital systems. And so we've got beds that we can't put another patient in, especially, if it's in our tertiary care center, they're usually running at capacity and we have to get one patient out before we can transfer in that patient from the rural hospital for the needed higher intensity of care. And then the cost piece of it as well. It's like if they're spending more days in the hospital, they're costing us considerably more.
And can you maybe speak to, or if recent federal efforts to streamline any of that at that prior authorization has made any kind of meaningful difference on the ground?
So obviously, I can't tell you what it would have been like without any of those changes, but I can tell you the trend. We have not seen any bend in the curve. In fact, if anything, there's an escalation in the number of denials and delays that we're seeing year by year. So we've certainly not seen any appreciable effect that I can tell.
Okay, thank you. The other thing, and I'm going to shorten this up because we're short on time, but from your perspective, which of the supplemental benefits, because you mentioned earlier not transportation, those kinds of things, and I just want to tell you, the transportation is a huge issue. I mean, when you look at my district and across rural areas, and I just want to just add, transportation is an acute issue. I've seen wives not accompany their husband in the ambulance because they don't know how they're going to get home.
Yep.
And I know that we can't necessarily cover it, but it is part of people's care that they have their loved ones with them, and that was heartbreaking for me But which of the supplemental benefits have proven most impactful in those rural areas?
So if you look at some of the ones like, I would like to be able to say that it's some of the health club benefits and stuff like that, because that should lead to more exercise, which should improve health. Unfortunately, I think those are underutilized by all aspects of our society, and so I don't know that I can say that. Probably some of the dental and vision plans are what you see most broadly, and makes it feel a little bit more like commercial insurance that people are used to, and certainly dental health is tied to medical health, and so that would certainly be one of those that I would point to.
And again, thank you for being here. I appreciate the perspective, given that you know healthcare in my district very well, and so I appreciate you being here. So
thank you.
Thank you, and I yield back.